Usually spasticity tends to get worse over the first year of injury. After 1 year of injury, it tends to stay stable. There are things that will make it worse and things that will make it better, and it's important to try and differentiate whether or not the spasticity is evolving due to its natural history or due to an underlying medical condition. Typically with a natural history, spasticity will increase slowly over time. It won't be a sudden change. If there's a sudden change in the spasticity over a short period of time, it really makes you think about why is the spasticity getting worse. In spinal cord injury, there's some very common triggers for spasticity, but bladder is the most frequent. The reason for that is that individuals with spinal cord injury develop what's called a neurogenic bladder, which is essentially the bladder and the sphincter that are no longer under control of the centers above the spinal cord. For example, checking the catheter, if you have an indwelling catheter, is the number one thing. It's the easiest thing to do, and often that's the problem. Checking for a urinary tract infection, that is a very frequent problem of increasing spasticity within a short period of time. And if those things aren't positive, then looking for things like the stones with appropriate imaging would be a very reasonable next step as well. The same thing happens with the bowel. You develop a neurogenic bowel, so a bowel that's no longer under control of the central nervous system as it was before, so you're relying on its intrinsic reflexes. So you tend to get constipation, hemorrhoids, fecal impaction, and those things can certainly trigger or aggravate spasticity as well. Because individuals with spinal cord injury lack the mobility that they used to, the sensation that they used to, and there's other factors that impair wound healing, they tend to have problems with skin breakdowns, so pressure ulcers, but even something like an ingrown toenail or an undetected fracture, those things can trigger spasticity. So you may treat the spasms in the meantime while you're looking for the triggers, but in the end, what's really going to treat the spasticity is finding out why it happened in the first place. It's important to understand why spasticity can get worse with medical conditions. What happens is that any stimulus below the level of a spinal cord injury can trigger the reflexes underneath that level of injury. And because the brain can no longer send a message down through the spinal cord to calm the reflex down, that reflex can be activated and it tends to persist. Common triggers are things that cause pain in a normal condition. Let's say that you're walking along the ground and you step on something sharp. So what typically would happen is that you'd have a sensation coming up from the foot. As a painful sensation, it would travel up the nerves into the spinal cord, up to the brain, and it'd be perceived as pain. In the meantime, you've had some reflexes triggered, so the reflex is to extend one leg so you can stand on it and flex the other leg so that you can take your foot away from the painful sensation. But it's a really short-lived reflex in someone who has normal spinal cord and brain function. The brain will then send a message down and tell those reflexes to calm down. So what happens in an individual with spinal cord injury is that sensation occurs at the level of the organ, so the foot or the bladder or the bowel. It travels up, but then it gets blocked at the level of the spinal cord injury so that the brain doesn't perceive that stimulus of pain or discomfort. The reflexes get triggered, but the brain can't send the message down to tell the reflexes to calm down. So you get this interesting picture where you get the increase in the spasticities, involuntary muscle reflexes and spasms, but the individual doesn't necessarily feel the sensory input from the skin, the bladder, or the bowel. So all you see is increase in spasticity. And unlike individuals without spinal cord injury, where you rely very heavily on the history to find out, well, what's going on? Is it your foot? Is it your bladder? Is it your bowel? With an individual with spinal cord injury, you have to use the spasticity as a red flag to go hunting for that thing that's gone wrong, so to speak, a medical condition that's triggered that spasticity within that short period of time.